Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just great. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest statistics and our last US COVID statistic through today, June 12th. We invite you to submit any questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with that most recent COVID statistic, average COVID deaths per day in the last recorded week in the US were 30 daily. In the same week in 2024, we saw 49 daily COVID deaths. Dr. Murphy, your reactions to those numbers?
Yeah, well, we're at the bottom here of the season for COVID and other respiratory infections. And so even the death rate is down to about 30. A year ago, that was 49. So that number is getting closer and closer. Remember, it used to be over twice as much, and now it's under twice as much. All going in the right direction, but remember, it's still 30 people a day. That's 210 people per week, and do the math, But it's still there, but it's going down. And also, when you look at the wastewater surveillance program, which I think is still in effect, we don't know what's happening at the CDC right now, how much they've given up. But it's very low, quote, very low, not low, it's below low. And that's just all going in the right direction. So, but we would if it's like every other year, there's a uptick in August. So there's a summer bump, then that goes down, and then we get the big bump in the regular respiratory season, which starts in December.
Now, looking forward and looking towards what could be that August bump, there is the newer COVID strain NB.1.8.1. Can you tell us a little bit about it?
Yeah, we've been talking about this for a little while. It popped up in Asia first, and as most of the cases out there, and then it was here. We've been mentioning it every week. Went from 5% to 10%. Now it's 38%. That's what happens. These strains that are more easily transmitted, they just ultimately take over. As long as there's replication, and we're still having, we still have infections out there. People are still getting it. The interesting thing about this is that the clinical reports are that people are getting a very bad sore throat. They call it razor blade sore throat. So this is different from the other ones. Remember, there was the smell problem, and then the conjunctivitis, and all these other specific things for different viruses. And now we have the sore throat, and it has a name. They call it the Nimbus Omicron variant. So it's maybe a little bit different. We're not really, we don't think it's that much more severe. It's presenting differently, but the Asians have reported more emergency room visits and more hospitalizations, but no hard numbers. So I don't really know what to think about that, but we're watching it. So far, we have not seen that. But we went just from just a couple of weeks ago. It was less than 10%. So we'll see what happens.
Yeah, we'll have to wait and see what happens there. Hopefully, we can get some hard numbers. But while we're on COVID, can you remind us of these new vaccine recommendations?
Yeah, there's some controversy here because we've got reports saying that children no longer are recommended to take it. Remember, it's all recommendations. But if the government doesn't recommend it, if the CDC doesn't recommend it, insurance companies may not pay for it. So they're saying now they don't think healthy children shouldn't take it, and pregnant women shouldn't take it. Now, both of these things are going to cause significant problems and deaths. We reported just a couple of weeks ago about the big study that came out in pregnant women that looked during the whole COVID pandemic. COVID is bad during pregnancy. It results in miscarriages and stillbirths and problems with pregnancy. The mothers have problems and everything. It's highly recommended in pregnant women. And all the major professional groups are recommending it. As for children, it's true. Most children do not die from COVID, but there are still deaths in children. And somewhere around a third to a half of the children don't have a recognized immunocompromised condition. So it can happen in otherwise healthy children. So even though it's a small number, it's real and it can be prevented. So, the complication rate from these vaccines is very well known and it's very low. And we also know that there's less long COVID with these vaccines. So that was really an unfortunate recommendation. But I think this is still kind of playing out because you're now having groups set up like different sets of guidelines besides the government. So, it's just going to cause confusion. And, people are, they're not following this as closely as we are. And, a lot of people say, well, the government says you don't have to take it. I'm not going to take it. I mean, who wants to take a shot and everything? I mean, it's, any kind of obstacle you put in there is going to lead to a decrease in the vaccination rate, which is going to have an increase in the morbidity and mortality.
Mm-hmm. Absolutely. And it is important to note that while luckily children don't have as severe outcomes from COVID-19, they can still spread the virus just as easily as anyone
Oh,
else.
yeah, sure. They spread all those diseases. I mean, working in the field of infectious diseases, I during my whole training, I never really got sick with anything. And then as soon as my kids went to daycare, I got everything. They just brought it home and we all got it together.
It's funny how that works out. But unfortunately, another illness that has been affecting children and adults across the US and globally is the measles outbreak. Can
Mhm.
you bring us up to date on what's happened this past week?
Yeah, we're close to 1,200 cases. It's going up and down in the various states. It really depends how well vaccinated those states are, is what's happening. We still just have the 3 people who died, 2 kids and 1 adult, none of them vaccinated. They this is where not the United States alone by any means, and now multiple states are reporting cases. But I mean, the Canadians are reporting even more cases, and the Mexicans also reporting cases. So I mean, it's really kind of all over the place. So it hasn't gone away.
And important to note, a lot of that spread is coming from air travel, both internationally and domestically. Can you fill us in on any of those
There was
details?
a great statistic that was just reported last month that there were more than twice as many measles cases in May of this year than last year. So, and from people coming from abroad. However, if you look at those cases, most of them are Americans who were not vaccinated, went abroad, got measles, brought it back, and then spread it. So it's mostly Americans coming back who are not vaccinated. So it's very unfortunate, but that's the cause for that.
Mhm. Of the nearly 1,200 cases here in the US that have been confirmed by the CDC, 95% of those cases have been among those who are unvaccinated or of unknown vaccination status.
Mhm.
As we and other public health officials keep repeating, measles vaccination is the best way to prevent the spread of
Yeah.
measles.
Yeah, if you get it above 95% vaccination rate, basically there's not enough people at risk, but it's at least 95%.
Mhm. Now, another story that we've been following for a long time, less attention here in the US now, is the H5N1 avian flu. I understand there's been more global cases, and can you tell us why we're keeping an eye on, these small clusters?
Well, Cambodia reported its 5th case. Now, who knows how well they report, but they have labs there. There's a Pasteur Institute, Cambodia. I mean, they have some facilities. They don't underestimate what they do have, and they can diagnose it. They reported a 5th case. Keep in mind that the first 4 cases died of this avian flu. Now, so this part of Asia had in the past reported avian flu cases. There's a lot of bird markets and whatever. There's a lot more contact with the infected birds. And they've reported up to 50% mortality. So that fact, and it which still persists in a place like Cambodia, unless this is just a reporting error or bias error. It's not a reporting error like they're reporting stuff that doesn't exist. No, they're reporting real things, but it may be they're selecting out the sickest people. But anyway, they've always reported much higher mortality rate. That's why we're all nervous. Now, in the 80-some cases in the United States, there's only one death. So we're not really quite sure why that is happening, but it's the thing that is of concern. Now, what has not happened is, although these things mutate, it's still animal to man. Everyone has been exposed to some infected animal, and the birds are loaded with it, and cattle have it, and whatever. So it has not been able to transmit effectively from human to human at this point. So that's the good news.
It is the good news. And our final story today reflects some of the highest highs and the lowest lows that we see here in global health, this time revolving around HIV. There, of course, has been some stalling in progress due to funding cuts on the global level for HIV prevention and treatment, not curing, but treatment. And then there's additionally been a massive, massive drug that has been approved by the FDA here in the United States. Can you tell us about these two stories?
It's kind of this yin yang thing going on here. So the goal, the overall AIDS treatment goal, and to eradicate HIV is to get the number of new infections less than the number of deaths. And as soon as that happens, the whole number of cases will just starts going down. And if you keep up the pressure to, keep the treatments going and prevention efforts, you can extinguish HIV in the world. All right. So the goal was by 2030, just 5 years from now, that we would be over that goal. Now, what's happened is the abrupt cessation of PEPFAR and the support in WHO and the blockage of all funding to South Africa, which is the country which has the most number of cases. They have 8 million people there with HIV. All of that has just really turned the tables on this whole eradication program. And they now estimate that there will be some 4 to 11 million new HIV infections, including 880,000 children by 2030 because of our actions. Now, we could have done it over a period we could have stepped it down, gradually done it, had other groups take over, whatever, but we just stopped. And this has got a consequence. So that will result in, by 2030, 770,000 to 2.9 million more people could die, including 120,000 children.
Absolutely. And it's important to note that, like you said, with that funding from those big groups, it's also the countries themselves with the problem of the HIV infections that are doing a lot of work to help those populations. And it's just really unfortunate.
And they've done an incredible job. They have better treatment success than high-income countries, including us. They can treat the people, it's effective. They've got the generic drugs, it costs $15 a month. The whole system is in place. Now a big chunk of it is just kind of disappeared. It's very unfortunate. But I don't know. The countries are stepping up and other funders are stepping up, but this is not like a switch you can turn on or off. It's going to take years to ramp it back up, and it's going to set us back with millions of new cases. It's really just tragic.
Very tragic.
The good side, and we've mentioned this in the past, but lenacapavir is a drug that is approved in the United States to treat highly resistant infections but it's been studied primarily in these sub-Saharan African countries that have all these cases for prevention. Highly, highly effective. We know that if you give 1 tablet of Truvada or Descovy, the related drug, once a day, that will prevent infection too. But you have to take the pill once a day. Now that sounds very easy, but otherwise these people aren't sick. So the motivation to take the pill, there's always people that don't take it and then they get infected. Now this new drug, you take 1 shot twice a year, and it works great. There is another concoction out there that you can give every other month, and a lot of people prefer that, but it's still, you have to get checked before and checked after, and you have to come in every 2 months and get these injections. So this is just much easier. It's a real game changer. And of course, in the high income countries, you're going to pay. It's $42,000 per patient per year. That's a full cost. No, there's deals you make with the insurance companies. How much does it cost to prevent HIV and blah, blah, blah. But Gilead, the manufacturer of this, is basically selling it at, or allowing the drug to be manufactured abroad in 120 low-income nations. The cost of goods is about $40 per shot. Now, that chemical costs about 40, but you have to give it and monitor the patient. So it's more than that. It's probably a couple $100. But they're doing that. They're not giving the break to the middle income countries. So like Brazil and Argentina and all these guys, they're not going to get the break. But they are doing a no profit approach to where most of the infections are. So it's really good news. It's going to be a game changer. It really is. And but so that's the good news for prevention. But then the bad news is we've stopped all the our chunk of the programs was so big, and we've stopped it so abruptly. So that was just unfortunate. So it's back and
Very
forth.
difficult timing. And when we reported on some of those phase 3 clinical trials for this drug in those low-income countries, some of the results were so astounding. There was one that sticks in my mind, which was in at-risk women for HIV infection. There was a certain group that saw 100%
Yeah.
prevention of HIV infection while on this trial. It's astounding.
You hardly ever see anything working 100%. I mean, but if you give a drug you only have to take twice a year, okay, if you come in a couple of days late, it's probably not going to make any difference, So you got these 6-month blocks. That's all you have to do to give it. And, remember in Africa in particular, it's a woman disease, primarily of women, 2/3 women. So, but it's just really remarkable.
Very remarkable. And we
Remarkably,
will keep our eyes on that movement.
yeah, we definitely will keep our eyes on that, and it's going to have a big effect. But now it's going to be offset by the other actions that have happened. But I was just in Africa, and I was just in South Africa, as a matter of fact, and the people are very resilient, and they're not stopping. I mean, they're going to do what they can do. But I mean, it's the big thing is what's really tragic is that this also includes the training programs for the younger professionals. And that is gone, at least for now. So we're going to lose a generation. But I mean, they're doing the same thing here in the United States with the NIH. It's 40% cut, and cutting grants and freezing funds, and Northwestern has been frozen. We've never received a letter saying why. I mean, we heard it in the news, but we've actually never received any notification. Colombia was the first one to get whacked like that, and then just the other day they unfroze the funds, but 6 hours later they froze them again. So go figure. I mean, this is the medical research establishment and the benefits we get from all this, which include all diseases, not just infectious diseases, is it's really going to take a hit. And
Absolutely.
it's going to hurt all of us.
Feels like the Wild West a little bit when that is the exact opposite of the normal
Yeah.
tempo of the industry. Well, on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down the latest headlines and the data for us. It's much appreciated.
Well, thank you, Katie, and have a great weekend.
Thank you. And thank you all for joining us for this week's episode of Ask Dr. Murphy. If you have any questions or comments, we'd love to hear them down below in the comment section or any of our social media linked in the description. We'll see you next week. Have a great weekend.
Bye-bye.